local COVID-19 patients have been given the same therapy as President Donald Trump when he was hospitalized. Nearly 50 people in our area have taken part in a study of the Regeneron antibodies through Avera Health. As Keloland's Angela Kennedy found out in tonight's COVID-19 Beyond the Numbers, while early results are promising, it's still waiting FDA approval for emergency use in severe cases.
Well, President Trump promised Americans they would soon be getting the antibody treatment that he said cured the disease for him. That's actually not the case because it is still being tested. Studies of the experimental therapy from Regeneron are going on in 1,500 patients worldwide. I spoke with one local man who was part of the ongoing study of the antibodies through Avera. Minnehaha County Circuit Court Judge Brad Zell was out of the courtroom for nearly a month. First, his wife came down with COVID-19 symptoms.
She's a teacher. She was teaching, her and one of her aides come down with it at the same time.
A week later, he started feeling sick, too.
Not as bad as my wife. I had headaches. I had coughing. I did get chills and fatigue.
When he tested positive for COVID-19, he was asked to take part in Avera Health's experimental antibody therapy study. He agreed, but he didn't know if he would actually get the treatment or a placebo.
This is considered a double-blind placebo-controlled trial, so we don't know who's getting drug and who's on the placebo arm of this. And so we speculate all the time of who we think is getting drug and who we don't, but at the end of the day, we really don't know.
Judge Zell believes he got the real thing.
I mean, obviously a placebo can cause a mental approach to it, but I would say I did, just the way I react. And then subsequently, you know, with President Trump getting it too, and he's about the same thing, 3 to 5 days, all of a sudden you're not back the way you were, but you are functional. You can, do things.
Researchers say preliminary results of the study of the first 275 patients given the Regeneron antibody cocktail were promising.
It showed that the drug had an effect in decreasing viral load, so how much of the virus essentially it was in the system, as well as decreasing the severity of symptoms and the length of symptoms, both of which are extremely significant when we're thinking about treatment of COVID.
If the antibody treatments prove to be overall effective, they are expected to become more widely available early next year. Regeneron says it will be able to produce about 250,000 doses a month. 2 other pharmaceutical companies are also developing similar treatments.